Sleep apnea is going to be the subject we talk about right now, and our guest is from MU Healthcare. He's an assistant professor with the School of Medicine, associate director of the Sleep Disorders Center, and associate director of the Neurology Residency Program from the Department of Neurology at the University of Missouri. Welcome into the studio, Dr. Pradeep Bollu. It's nice to meet you. Thank you very much for joining me. How are you today? So I have a general question about sleep apnea. What is the occurrence of that now? How many, statistic-wise, how many people deal with this?
Sleep apnea is a very common disease right now. According to one recent statistic, about 25 million adults in the U.S. Have sleep apnea. And if you take this population group of between 30 and 70 years, about 1 in 4 people might be having sleep apnea. So it's that common.
As I was thinking about this last night, I was wondering, 20 years ago, but for sure maybe 30 or 40 years ago, was anybody talking about sleep apnea?
Not that much, because we didn't know much about sleep apnea at that time. The second important reason is, at that time, obesity was not that big of a problem. And that has become a very major public epidemic right now. So along with that, sleep apnea also has gotten more common in the population.
But you don't have to be obese to struggle with sleep apnea.
Exactly.
What is sleep apnea?
So when we are awake, our breathing is pretty smooth and straightforward. However, when we go to sleep, sometimes our sleeping will not be that smooth. And when the breathing is not that smooth, the brain constantly has to wake up to make the breathing in and out smoothly. And when it constantly keeps waking up in the night, it cannot go to sleep. It cannot get a good night's rest. So effectively, keeping you sleep deprived for the entire night. And when you wake up, you might be thinking that you got an 8-hour or 9-hour nap, but you did not, because the brain was not resting. It was constantly waking up to keep you breathing. So that is basically sleep apnea.
How do you test for this?
Sleep apnea can be tested using a test called sleep apnea testing, and it can be done in 2 ways. You can have the person come to the sleep laboratory where we test for sleep apnea, and that's a more sophisticated study where we get a lot of data. Another way of testing for sleep apnea is by using what is called a home sleep apnea testing, where the person carries the equipment home, puts it on, sleeps on his or her bed, and in the morning they send the equipment back and we analyze the data and see if they have sleep apnea or not.
So what does that data show? Something about brain waves or breathing rate? What would you find from that equipment?
So from the home sleep apnea equipment, what we can find is how the breathing pattern has been, how the oxygen saturation has been, how the chest and abdominal movements have been. And based on all of these parameters, we will derive numbers which will tell us whether someone has sleep apnea or not.
We're talking with Dr. Pradeep Bollu from the University of Missouri Med Center and also MU Health, the School of Medicine. So what is, when I think of I guess it's treatment for this, I think of people who wear a mask. It's some kind of and I don't know what what's that called? I should know what that is called.
Absolutely. So in sleep apnea, the most common variety is obstructive sleep apnea, and that happens because of airway obstruction. So airway, you can think of airway as a balloon. If we splint open the airway using positive pressure from outside, you can keep the airway open and let the breathing in and out smoothly. So that is the basis of this most common treatment modality for sleep apnea called positive airway pressure therapy, PAP therapy.
Okay, and so that is being used by some, but are there new ways of treating sleep apnea?
Absolutely. Actually, PAP therapy is the most common variety of treating sleep apnea, but now we have other treatment options. One is a sort of mouth guard where the patient puts the mouth guard in the mouth that will actually pull the jaw a little forward, making more room in the back of the mouth, letting air in and out. And that device is called a mandibular advancement device. So that is one modality of treatment. The second modality of treatment is a very invasive surgery involving the jaw. where the jaws are pulled forward. That's the second modality of treatment. And now we also have a new modality of treatment called Inspire therapy. And this Inspire therapy, what it basically does is, using a battery-powered stimulator, it stimulates one of the tongue muscles. And when that tongue muscle is stimulated when you're sleeping, the tongue moves forward a little bit. And by moving forward, it makes more room behind for the air to get in and out. And thereby, it alleviates the sleep apnea.
Most of those sound like they're just minor little adjustments, either to the jaw or to the tongue. A small adjustment makes a huge difference, is what I hear you saying.
Absolutely, absolutely.
If you did that, the Inspire therapy, and again, you say it's a little stimulation on the tongue, how do you do that? What's implanted, or how's that done?
So overall, first we have to find the right candidate for the Inspire therapy, and the right candidate is someone who cannot tolerate the traditional therapies. And these people should not be extremely obese. Their BMI should be less than 32, and they should be right candidates. And there are a few other things that we'll screen. But bottom line, once we find the right candidate, they go through what is called DICE, where the ENT specialist makes sure that the airway is not fully collapsing. And once we know that, what the ENT surgeon can do is he can put in a battery-powered device, and a wire goes into the chest wall to detect your breathing, and another wire goes to the nerve that stimulates one of the tongue muscles. So when you are sleeping, the device will detect your breathing pattern and keeps stimulating that nerve. And that nerve ultimately ends up in one of the tongue muscles that pushes the tongue forward. So this is like an automatic therapy. You turn it on at nighttime, and in the morning it turns itself off. But while you're sleeping, based on your effort of breathing, it keeps the tongue moving forward as you take air in.
I said a moment ago something I want to backtrack and revise. Subtle changes in the positioning of the tongue or the jaw. But what you just described seems to me like you would only use that in certain radical situations of sleep apnea. Would that be true?
Not necessarily. Some people have sleep apnea. They want to get that treated. And untreated sleep apnea has a lot of health consequences. But they won't be tolerating the conventional therapies like CPAP or BiPAP or oral appliances. So in that situation, you have in the past we did not have any choice. We just had to let the patient go because nothing was helping. Whatever we try, patient was not tolerating. But with this new technique, patients have now the option of using a therapy that is actually proven to be very effective. Where it can open up the airway with subtle tongue movements towards the forward, and thereby treating the sleep apnea.
Interesting. Fascinating to think of that. Has it been used in a lot of situations now? So this is a standard alternative way of dealing with sleep apnea if none of the other ways work?
Actually, yeah. This therapy has been tested rigorously in a large clinical trial that started in 2010. And people have been using this very commonly. Like more than 3,000 adults now have this device implanted. And the effectiveness of this therapy has been actually very good.
3,000 out of what, 25 million or so, did you say, that have sleep apnea probably?
Right.
So what are the symptoms? Before I let you go, you said that there are some consequences of untreated sleep apnea. What would show up if somebody has sleep apnea, never been tested for it, don't know that they may need to be tested for it? What are they seeing happening in their lives?
Well, a lot of people with sleep apnea, they wake up in the middle of the night gasping for air. In the morning when they wake up, they don't feel refreshed. During the daytime, they feel tired and sleepy. So those are the short-term consequences. However, untreated, sleep apnea can have a lot of long-term consequences. And we know from a variety of studies that untreated sleep apnea will increase the risk of high blood pressure, increase the risk of diabetes, poor blood sugar control, increase the risk of heart disease and stroke, cognitive problems, along with mood problems as well.
Anything else you want to tell us about this? If somebody's curious about what you just described, or maybe wanting to know more, how do they find out more information about this?
We have a comprehensive MU Sleep Disorder Center at the University Hospital, and if they want to talk to someone, they can always talk to their primary care physician and get a referral to us. And the direct line to the referral is 882-1515. There is also some information posted on the website about the new therapy that we are offering. And there are a lot of resources online to learn about sleep apnea. But the bottom line is sleep apnea is a big public health problem. It is in epidemic proportions, and untreated, this is costing a lot of healthcare dollars and is amounting to a lot of morbidity, and it is increasing the mortality.
Should family physicians, general practitioners be asking their patients about their sleep habits and how well they sleep?
Absolutely. Though we are sleep specialists, we only can take care of so many patients. As this is such a common problem, more awareness in physicians is very important, especially family practice physicians and internal medicine physicians, who are the first line when it comes to patient care. When they are more aware of the ill effects of untreated sleep apnea, they'll be putting more focus on identifying the right patients and identifying the right treatments.
Doctor, I appreciate your time today and the insight. I appreciate what you've told us about the Inspire therapy, but everything else about sleep apnea also. And it's very enlightening. Good information. Thank you.
Absolutely. Thank you very much for having me.